All right, so Lynn's going to start us with some trauma information.
Okay, so hi everyone. Can you see my screen?
Yes.
Does it work?
Yes.
Okay. You probably see too much though, right? You probably see all this over here too, or
well, we see all of it. So if you hit the little thing in the bottom that goes to slideshow, I don't know how to, or go up to slideshow, or go to that one.
Start from beginning. Okay. And how do I switch? Oh, okay. Okay. This is really quick. This is actually like an hour presentation that I'm putting into 5 minutes. So I just want to go over, and just the basics of what we see, right? What we experience and what can we do. So this is just like a brief idea that trauma has always been around, something we've discovered more recently, like in the diagnostic manual, but even Shakespeare described it to a T. I'm going to just kind of spare you all of this as far as the basics, but I think the idea of that, of course, now I can't see everything that I wrote. Trauma is the emotional response to a terrible event, like an accident, like a rape, like a natural disaster. This is from the APA, American Psychiatric Association. Immediately after the event, shock and denial are typical. Longer term reactions include things that we think about then for like when our soldiers come back. But the thing is, what makes it different between something you and I may experience of just a terrible event is how we process it, where it goes. And often it stays in our brain and our body. And so that's what we see often in people that have long-term effects from trauma. It's the exposure, right? So I think some of this is going to be a little bit redundant, but it's the idea that either directly being affected by the traumatic event, experiencing it, sometimes it's also witnessing it, right, in an event, in person, or even what they're saying is even hearing about it, or seeing the photos. That can be a way of experiencing it as vicarious or secondary trauma. So moving on, something I wanted to bring this in here because this is a fact. Racism, treating others negatively because of their skin color or physical appearance, causes psychological trauma and toxic stress. So if we think about that, knowing that so many of our students are of the BIPOC, that we are then like encountering the potential of this type of stress that they've been enduring, keeping in their body and brain for potentially forever, right? So basic 3 types of trauma that people experience is the acute, the idea of a single incident, chronic, meaning over long time, and then recently, like being more inclusive, the idea of the complex trauma, the idea that the invasive is happening for, and potentially different types of trauma. There's so many types that people experience throughout their lives. So these are just a few that we know about. I'm trying to move my thing there. Oh, I see. That's how I move it back and forth. So even bullying, we think about, oh, that can be a traumatic experience that someone might be enduring for years, right? So the idea of the different types of trauma that can be experienced. So the symptoms, signs and symptoms. If you think about some of this behavioral, the agitation, irritability, sorry, this might be kind of small, hostility, hypervigilance, self-destructive behavior, social isolation. These are things that we're going to see among the prison population, potentially because of the trauma, but also like because of what they're enduring. So if you think about too, the potential traumatic experience that they're having from just going through the carceral system, of going through the courts, to getting into processing, to getting into the receiving, to how long they've been there, which prisons, the constant moving around, so all that they're enduring, and then the idea of all the day-to-day of the COs and the hostility they may experience from that. So that in itself, any of us would potentially be consider a traumatic event. So the fact that they're doing that in that environment day to day. So they may be experiencing a lot of the symptoms, and then behaviorally showing that. And that in itself, again, isn't like a sign of trauma, but the fact that that is something that we can be looking out for of things that could potentially mean. And then the things that they're experiencing, the flashback, fear, severe anxiety, and mistrust. So thinking about that, the trust factor is something that to be aware of, and why potentially they may not trust us right away, right? And so some of the moods that they can experience are just even so much more than what's listed here, but also that they may be experiencing insomnia, nightmares, that their sleep can be extremely disturbed because of it. So they're going to be thinking about like that, avoiding as many things as they can that might remind them of it. And sometimes it's new things that remind anyone of previous trauma. So that will be something to think about, and that they might have lack of motivation and anger and memory loss and tend to self-medicate. That there are, so many comorbid things that come with trauma that you will see in the mental health field. So thinking about that, and I'm just trying to truncate all this as much as I can, so that you were going to see a lot of the different experiences, the depression potentially, all the different things. We'll never know what's triggering somebody. So if we see someone experiencing something, or like just checking in, I think is the best way to help understand that. I wanted to share this with you because it's Resmaa Menakem is a very prominent somatic trauma PhD, and he talks about the racialized trauma regarding the Black body trauma. And so these 4 categories help me understand a bit of his theory called the HIP theory: the historical trauma that the Black body has experienced, the intergenerational trauma, a persistent institutional trauma. And that's not even talking about prison, talking about just like day-to-day, potentially like how the institutions we've all involved with can be traumatic experiences. And then the personal trauma on top of that. So we're thinking about these 4 different categories that a lot of the people that we're encountering inside of prison have potentially been experiencing. And so the threat cycle, just really brief on this, is that fight, flight, freeze, and then fawn. Like we might see somebody like actually give in, right? Okay, that's the brain. I won't go into that right now, but I thought this was really cool because if this is a little diagram, if you all can do this, we can think about how our limbic system is like, maybe I shouldn't even go into this, but we got the amygdala and we've got the hippocampus. These are super important to the whole process of how we process information in a traumatic experience, or a lot of experiences. And then our whole, like, if you put your hand over that, then you have your prefrontal and your whole cerebral cortex. So it's, to me, it helps like go think, okay, it's all in my hand. I've got it right here, like a perfect diagram to think about how like fragile the whole system is too. And the fact that like these don't communicate to each other. Our part of our brains do not connect and communicate when we're in a traumatic situation. And that's what our brain looks like when it's under that hypervigilance. So to think about that, that's what potentially some of our students are experiencing at all times. And because of the trauma, the brain continues to stay in that hyper arousal state at times. And so that's why it can be really a traumatic experience to have that over and over, and exhausting. So you think about why sleep can be so challenging. So this is something I found that I thought this was really interesting about in the correctional environment. So the fact that a lot of the staff are not going to be trauma informed, some on their own potentially, and some have some, but like in general, the staff, the correctional staff that we're encountering don't have that. So things that we can do, like thinking about how do we include and create a safe environment for them to feel good about. And this is interesting because this says like eye contact and explanations. A lot of them don't have the ability to have strong eye contact because of that trust, and because if they're in a traumatic state, that's not safe. So thinking about how we can offer that and then understand. And I like the idea of that there's times when you're in a traumatic state, you can't hear, you can't process. So having explanations in multiple different ways, how we're talking about even in this remote environment, how we have to repeat ourselves a lot of times. And so thinking about how we can do that in different ways. And I think the idea also of giving them choices, as much as because they don't have very many in that setting, and then collaboration and empowerment. I really like that idea of how can we empower them, right? And to think about how that we're helping every time we do something like that, we are helping with that cycle to give them some autonomy and some self-efficacy. So that's a whole other thing, ACEs. What else can I share really briefly? There's so much more to say. I think I'll just like leave it though there. There's so basically trauma informed is for all of us to understand, right, that it comes in so many different forms. And so the way that we can recognize and respond is by just being as open as we can, and taking care of ourselves, because secondary and vicarious trauma is a real thing as well. Okay, there's so much more, but I am going to leave it at that. And thank you. I hope that gave you a little bit of information.
Lynn, could you really quick go back to the slide with the 5 things around trauma-informed care?
Yeah, sure.
Or that I think we should just call, acting
the incarceral one
another. Go down. Does anyone remember?
Was it
Now keep
the
going.
one that was specific about incarceral?
Yeah, it was after the brain stuff. Yeah, it's slide 18, I think.
Okay. You see it?
I think it's 18.
Oh, am I sharing it? Is this it?
Yes, you are. Yeah. Could you cut and paste that stuff into the chat by any? Don't you love PowerPoint when it does this? Can you cut and paste that stuff into the chat? Those ones right there?
Sure.
I think that would be great.
I'm not seeing anything, sorry, but I do not see anything. I just see
you don't see the safety trust.
No, it says it's my internet connection, so sorry.
Oh,
my bad.
Sorry. I can send over this whole entire PowerPoint, but there's a whole lot more on there that may not be exciting for everyone.
Look at it.
Okay. I geek out on this stuff. This stuff makes me like, it's super interesting to me. I love all the brain stuff. Okay, I will put that.
Thank you. If you could put that in the chat, I would appreciate it. I feel like that can be one of the helpful pieces, but maybe other people like other parts of it. Marina, I don't know if you want to add additional things now, if you want to do part 2 in March, like what's
mine was shorter because it was a 10-minute segment for in-service. And really what I wanted to add, and I have a PowerPoint, but I'm not going to do that. But I don't know if you guys heard of Bruce Perry, who is a specialist basically on neurosequential model. And he was a pediatrician who worked with kids with a history of trauma and realized that the effect of traumas really do show up in the way how the brain develops. So he created a neurosequential model which basically says that, the earlier trauma affects the earlier parts of our brain, right? So the lizard brain, or then midbrain, limbic system, and the last one, or the top one, is the cortical part of our brain, which is our highest function. And what cortical part of our brain is responsible for is abstract thinking. So one very important part to remember when we teach students with a history of trauma or who's going through the trauma, because the statistic here says among a male prison population, the rates of exposure to violence or traumatic events is anywhere between 62% and 100%. So we have to be aware that majority of our students have history of current and past traumas. So again, going back to abstract thought, if you realize that that is the function that has been affected most, so how do they process information? They have a difficult time understanding abstractions, and they will benefit from things like as concrete explanation as possible. It's almost like a child development, you don't get to abstract thinking until you're adolescents. So the very same thing works here. And so my presentation really talks about that whole cognitive realities. And this is where reminders, work, this is where repetitions are essential because memory problems comes with the neurosequential model, difficulty with logic. And one more important thing that I want to mention, and then I'm going to stop, is the faulty interpretations. That is because, again, emotional ability and, like Lynn mentioned, being hypervigilant, they're very likely to misinterpret things that are ambiguous. And they're going to misinterpret it as an attack. I actually had a pretty, you know, clear example of that already. I had a student who dropped the class because he reacted very strongly to the question about his cultural heritage. And his answer was, that's too personal. I'm not going to talk about my family. And I actually wrote him back with understanding and with encouragement. But what I said, I was not asking about his personal family, right? So cultural heritage for him sounded as intrusive question about his family. This is a perfect example of faulty interpretation. So being aware of that kind of, makes us think about how we phrase our questions, or, even being forgiven for some response that were like, what? I didn't mean that, but this is just how they interpreted the question. So this is what I find very important and relevant. And just the short sort of my things to do or try to do. Again, detailed instructions, almost as imagining talking to a preteen. I mean, they're smarter than that, but it would help them. Okay. Repetition reminders, focusing on concrete, clarifications, and summaries. Summaries are extra important with this population. Just go over what they've learned, go over what they did, and any type of repetitions. And as far as Lynn mentioned empowerment, I find that essential with this population. When they answer good, I don't just skip to the next question. I comment on how good it is. All right. So, I actually have a list of 101 words to praise. It's called Praise a Child, but I use that to praise my students. So I just don't get like great job, great job. So I want to be, so I have awesome, I have stellar, I have superb, I have amazing, I have, so you get the idea. That is what contributes to self-efficacy and empowerment with our students. So I, recommend to use praise and encouragement everywhere you can. That's pretty much what I want to add. Kalinda, you're muted.
And I said, thanks a ton and all kinds of nice things to you, Marina. This is our first time doing this. And as I'm thinking about it, it probably would have been good if I just divided it up, because both of you tried to rush through the information, which I appreciate, so that we could get to discussion. What I'm wondering is kind of what people are wondering now, right? So you've heard this. It's a lot of information. Marina and Lynn are both therapists and have also done lots of other work teaching and group level things. And so them and I are coming from that kind of background, right? And so what didn't translate? What didn't you like? There's some kickback right now about using trauma informed instead of using like a resiliency strength based kind of language. So there may be some things that you didn't like as language continues to evolve and we try to capture it in psychology as a way that's non-pathological. It's very hard, right? And so there might be some things that you're reacting against. That's cool too. So I'm wondering what questions you have, what things you didn't like, what you're thinking about. Just I want to open it up for discussion.
If you guys don't mind, I'll start. As Marina was doing her presentation, it reminded me of an email that I received over the weekend. And I had a student who was an older woman, and she sent me 3 separate emails. I don't check emails on the weekend because that's my time. But she sent 3 separate emails over the course of the weekend. And she was referring to my comments on her on her assignment. So this is the classroom outside of the prison, right? So this is one of my classrooms at CRC. But it reminds me exactly what Marina was talking about, because I had written in her comments, which I do to a lot of my students, careful with language. And what I mean by that is sentence level errors, you know, punctuation, all that kind of stuff. Well, she took it to mean that I said, watch your language, like watch what you say, because that's not. And so she's coming from, so this is an older Black woman who had, again, in these emails told me all about her trauma growing up as a Black woman in America. And she perceived what I said in a completely different way. And it just shocked the hell out of me. So when I emailed her back and explained all of this, then I received an email this morning and very briefly she said, oh, thank you, I just made a mistake. And that was it, right? So that just diffused the whole thing. So it just reminded me when Marina was saying this, that the way that we word things, even if it seems innocuous to me or unintentional, I could, you know, I can push on certain buttons that are very traumatic to students without even, you know, knowing that. And it just reminds me every time that we get together and we speak that all of these things are always in the background. I just wanted to share that with you guys.
Thank you, Alex. I love the fact that you brought something in that I wish I had brought in the beginning, which is the fact that what we're talking about is relevant to students on campus or in our online courses, as well as students who are incarcerated. We may see a higher percentage for students that are incarcerated, but it's relevant regardless of where we are, right? And I often think that that's a really important frame for us to remember, because if not, we can be engaging in some, you know, deficit stereotyping of students who are incarcerated in a way that I don't think is also helpful. So thank you for bringing that in. Tavares.
Yeah, I'm dealing with a lot of types of students. You know, I mean, it's the full gambit from the students in the carceral system, parents, students with IEPs, students on medication for physical or developmental disabilities. I have people coming from backgrounds from different cultures and ethnicities. And as an art instructor, I've always come at teaching art instruction as like responding to trauma of the fact that art is underfunded in our culture, trauma of students feeling like they can't be artists or they don't know how to draw, which a lot of people say. So there's like lots of lots of roadblocks for the students that I encounter, just to engage in the simple practice of putting a pencil to a piece of paper, which is so democratic in our culture. But I feel like has been said that positive affirmation goes so far. You know, I tell the students, you are doing good. I am proud of you. You can do this. You know, you will be successful. And they respond to it. You know, they don't want someone who's going to be like hard-nosed, like this is art. Art is a certain thing, you know, and but just you know, fostering the fact that they can have a positive experience, whether they are making excellent drawings or they're just putting in the effort. That is what I appreciate, and I think they respond to that well. And I've had a lot of success with them improving over the course of the semester. You know, they go from like drawing simple lines to doing amazing things, and I think they surprise themselves too sometimes.
That's so cool. Thank you. Jamie.
Yeah, I sorry, my 5-year-old's running around.
You know, that's great.
Yeah.
I like 5-year-olds.
Yeah, I teach theater, and this is actually my first time with this program. So I'm definitely already learning right off the bat. I need to sort of rethink what I'm teaching a little bit. But I started with a playwriting thing, just a short, quick writing a play through how it sets it up in the textbook, and I found myself getting a lot of writing back that is, of course, full of deep issues that they're dealing with, and I immediately was like, oh, this just doesn't, I don't want to just grade them on the structure of how to do the play, which I never do. I'm more used to theater is an incredibly interactive. I have to be making eye contact, be in the space, hearing them, because it is incredibly subjective. But I'm finding myself having an issue now already commenting on that, writing that line of the structure of just, did you understand the information? Does this meet the information, to also where they're writing things that are incredibly personal, definitely from trauma, or coming from trauma or some place of difficulty. And I became incredibly worried that I'm over criticizing them, or what if their score, they're seeing their score based on their writing, not just me saying this doesn't meet this. And so I just relate to this right now, because I'm going through that just in my first or my second module. I went, ooh, I won't do playwriting probably next time in this format for this, correspondence thing, because it's too subjective, and I'm already, anyway, I'm trying to figure out how to write that line, because I also felt myself writing comments and then erasing it, and I'm like, that's not going to look good. But I'm literally actually not sure what to say, because I'm also trying to be very supportive. So
I think Kathy had a response to you.
Yeah. I think it's cool as a writing instructor that you're asking your students to write. I think that's super. And my students are telling me about all the writing they're already doing a lot of writing. They write letters, they write raps, they write poems. So and I've been telling them, all of that will help you as an academic writer too. So keep that up. I think plays are a great idea. And one thing I always have students do is free writing, which is it's a perfectly widely accepted composition theory practice. And I give them points for doing it, but it doesn't matter what's in your free write. And they're really responding to this. They love this whole idea. It doesn't matter. You don't care how I spell anything. I couldn't care less how you're spelling anything. The format does not matter. And trust me, the more you do this, the more it will be, you'll find yourself able to write those more formal exercises where you have to pay attention to the form and the structure and all the rest of it. They really love this. So, if the college composition class is supposed to teach transferable skills that will work in other classes, I'm just saying, all of you can tell them, do free writing.
well, they all attach to the drama therapy part of the textbook. All of them are like, I really like this drama therapy thing. And I think they attach that into the script writing, because they were like, oh, this is a chance for me to process. And I could read that, and I like that. I want to encourage that. I just put a different kind of sort of standard that I don't now. I have to rethink for that reason. Yeah, because it feels like it's, a lot of them are worried about their handwriting.
Yes.
And I don't care, and I do my best to read. And some of them can't write. The script thing was very hard for them, and they tried really hard. But I don't want to just say that wasn't good, because I saw that they're really trying. So yeah, thank you.
Thanks, Jamie. Are there other thoughts out there in response to either we have Alex, Tavares, Kathy, and Jamie all shared so far, either responses to what we've been chatting about, or something in response to what Lynn or Marina offered us, which I appreciate you all offering. Thank you.
I just wanted to say that my approach to the writing is a little bit different, because I teach business, and I'm trying to get them to format their papers in a modified APA format, since they don't have word processors. But the biggest challenge that they have for me is writing in the third person. This is just really, really, what does that mean? Oh my God, but once they get it, they're able to take that step back and write a little more analytically, which of course is the purpose of third person position. And they embrace it. The other thing I was going to say is that for the last couple of classes I've had, I'm really surprised and pleased at the quality of the handwriting. These guys, you're right. They must write a lot, because their cursive is generally, well, it's better than mine. I block print because my cursive is so bad. And my comments, I type my comments. I don't even try to write comments because that's not not productive for me. But yeah, I think the more in any format, and I agree with Kathy, any format, whether it's free writing, poetry, plays, whatever, it's the translating thinking into writing and putting it down on paper so you can analyze it yourself and someone else can analyze it is enormously valuable in that educational um, process. So
Thanks, Scott. I'd love to talk a little bit, unless someone has something else they want to offer. I'd like to talk in response to this a little bit about how we scaffold up students. I think what Marina said is important. I think what Lynn shared, there's lots of stuff that was important in both of them said, but the idea of how we interact with one another in written feedback and the way and the idea of how do we scaffold up to more abstract thinking. So this scaffold thing is from anyone other than me trained as a K-12 teacher? Anyone? Okay, so do we talk about scaffolding in anywhere other than K-12? Other people heard?
Scaffolding from child development courses.
Oh, okay, yeah. Okay. Vygotsky kind of stuff, right? So the idea of scaffolding, right, is kind of like like leading students up to wherever you're trying to go, as opposed to say, here is what I want you to do, now do this. Right. And so the idea of like, how do we scaffold up in light of not only the trauma that people have experienced historically, but the chronic and acute stresses which continue to happen right now. And okay. I also would love to talk about the way that racism is intersecting in the work we're doing as it relates to this topic. So I'm going to put both of those on the table. So whatever people are in the mood for, Tavares, I got a hand. Look, I just throw a couple things out about scaffolding or racism and I can get a hand. Thank you. Tavares, I'd love to hear from you.
Yeah, I don't know, but it seems like there's some equity issues in the way that I'm receiving packets, and I don't know if that's based on I don't know what that's based on, but it seems like certain packets from the same students are always coming on time. They're getting their assignments on time, and other packets are coming at other times. So I think there is some type of perceiving to be equity issues with the receipt and transmission of the materials.
Hey, Tavares, I have similar issue, and my students wrote to me that as they put it, there's a hierarchy, and the stuff, basically, I don't know if it's posts, I'm not sure who's doing that, but there are some complaints from students that someone's checking their packets and they're taking stuff out.
Mm-hmm.
I'm not sure, how to handle this or how to check this information.
Yeah, like one of the packets got sent back. I never received it. Some packets I only have the first week assignment. Certain things like that. But a few students have done every assignment on time, and yeah, I think that idea of the hierarchy or pecking order is happening, and it could be based on a number of things, but equity, I'm sure, is involved in how that is being processed within that carceral system. So that is a challenge, and yeah, I think like the idea of the racism and trauma occurring broadly across all of our institutions is definitely a factor. There's like a meme thread happening on social media right now about like, name the first time you had a black male teacher, and I don't really know how to engage with the students in the prep program regarding identity politics. I'm not sure it's necessarily appropriate, but I know I'd like to share parts of myself that I feel I really can't at the moment, because there's a certain way of there's a certain culture with that type of community, and for the most part, they are interested in learning and engaging on a humorous level. At some times, others, they just kind of, they don't know what why, they don't even know why they're in the class. Some of the students are like, why am I here? Like, I did not ask for this. What is this going to be like? And I just try to tell them, this is this, a C1 humanities course, university transferable, required for AA or BA, and just like let them know that, even they just have to take it for some reason other than what they wish, that it could get, it could lead to something. I don't know.
Yeah, I think these are all pieces on the table that we can continue to talk about throughout the semester. One of the things that you just shared about, that's another example of scaffolding up about just college information, right? Like they don't necessarily have access to like a student handbook. It's not like they can go online, right, and do all of those things. So there's a lot of stuff in the things that you just said, but also I think I want to be real clear that the amount, like, I think that sometimes we like to, this is just my opinion, and I mean, I can look on this, everyone knows that I speak pretty clearly, right? So I mean, pretty directly. So I can look on our screen and see a lot of what appears to be, and I understand that people's racial and ethnic identity is not always not always clear by looking at skin color, but what appears to be a high percentage of white folks. And this is true across our nation when we look at people who are teaching in correctional facilities. And so I think there can be really a big tendency to want to look away when we talk about trauma, to want to look at the way that mass incarceration intersects with systemic racism in our country. And it's real. If students have the opportunity to talk about it, you will see you'll see very divergent, very strong feelings coming across the paper about what's going on. And so actually, I think in March, we should talk some about vicarious trauma and the way in which we respond when those comments come. Because when we think about one of the things that I think of, so regardless of whether you like the term trauma, it's kind of the construct that in my brain stuff is still stuck to help me understand. So this idea of hyperactivation and numbing, right? So this like, and then you'll see that from week to week. Sometimes the student will be hyperactivated about something, and then they'll just be like, okay, I just got this done. And it may or may not be a trauma response, but I think it's important to understand that the students are very aware of the racial things that are going on. Now, whether we talk about a hierarchy as to whether or not they can get their paper out in envelopes, whether it's about race, whether it's about crime. If you're at Mule Creek, there's people who sex offenders or sex offenses, however we want to say that, people who've been convicted of sex offenses, there's this like whole hierarchy of crime, right? And so there's that piece that's going on. There's a lot of stuff going on for students that we may or may not know about, just like on campus we may or may not know about, but it will come out in the work that we're doing. And so the bigger question is, how do we continue to respond to it? And so that this becomes important to me. I don't like to like put racism on the table and then it kind of goes away. It's here all the time. Us white-bodied folks may not be experiencing it, but those of us who do not live this place in white bodies are experiencing it. And it's important that it's always there in front and center of whatever when we're trying to understand students' experiences. Okay, so sorry, I promised myself I would not preach today. Sorry, y'all. I kind of got off track. So, Trudy, did you want to say something or not? Did you want to say something? You're unmuted.
No, I'm just listening.
You're just listening to preach.
I'm just listening.
We have a few minutes here. I'm just wondering if if anyone has anything else they want to add, say, they're thinking. We threw a lot of stuff out. I don't know if we threw any helpful hints out or not. So if you feel like there's something unresolved, something you would like to ask the group, something you want to say, go for it.
I'm really looking forward to how we respond to answers that seem to come from a place of trauma. Because remember the last time that we got together last semester, I was telling all of you guys about how shocked I was when we were talking about women in history, some of the responses that I got. And that was a really good discussion. I'm looking forward to going deeper into that. But it was funny because I was just talking to my wife and some folks that were over yesterday about that response and how off guard I was caught by it, because I was always thinking about, race and prison politics. And this kind of hyper masculinity really kind of caught me off guard. And, I think it's a really good discussion to have how we respond to these kinds of answers that we get.
Okay. Awesome. I will do that for the beginning of March for our first week. That's great. Christina.
I just wanted to say thank you for putting this all together and giving us some foundation. I think that at Los Rios, we make an effort to talk about race and to talk about our students' issues. I think the effort is there, but I think that even with our intention, I think many of us, myself, I need more information on trauma and the underlying layers. And just from last week, when I think Marina said, well, you're repeating yourself because their brain is affected by what they've experienced. I'm like, oh my gosh, I was just like, I said that 50 times. And I'm not even like considering their experience whenever I think I am. But so learning all of the layers, even I think it's a work in progress. I don't think I'll ever be done. And I mean, this is just you all shared some slides that probably took years of experience for you to even understand. So this is a small look for me. So I just appreciate it, because I think that, the efforts are there, the conversations are there, but I even find myself, when we talk about race at an institutional level, getting so angry. And I don't even know where that's coming from sometimes. So just change that situation to women of color in an institution that's highly masculine, like you're saying. And coming from the English department, where we celebrate first person and the narrative, and then I think, oh, I'm going to ask them to share their personal experience. I'm going to empower them with that. Well, what if they don't want to do that? So there goes the Lynn's tip with the option. Maybe have a third person option so that they don't have to go there if they don't want to. So I appreciate all of this.
Yeah, thanks. Oh, go ahead, Scott. Or Tony. Tony, did you want to say something?
I'll let the, I respect the age, so I'll let my older veteran go first.
Thanks, Tony.
You're welcome, Scott.
Just two things. One, I found that, first of all, I have enormous amount of respect for anybody who is incarcerated and is pursuing a higher education. I realize that there's rewards for that in terms of shortened sentences and things like that. So there's some which you could call selfish motivation there. But these guys work and look, I'm an old white guy, and I try to be upfront with my students about where I came from. I mean, my father had a college degree. My mother went to normal school. Two or three of my uncles were teachers. When I was 10 years old, I was going to concerts at the University of Minnesota, the symphony. There was never a question that I was going to go to college, and my background is completely different than these guys. I struggled to get my bachelor's degree. I can't even imagine what it would be like to go through an experience where you have so many barriers and to still be able to pursue higher education. I mean, you've got to really respect these people. That's the first thing. Second thing is that as this, this is Black History Month, but as more and more of these issues of the historical treatment of Black people and people of color of all persuasions, as this history becomes more public, it's surprising that there's not a revolution here. I mean, this is, the Black Panthers had that kind of a reaction to it, and I think that the what's the word I'm looking for? The tolerance and the willingness to work in the system for a good portion of these people is something else that we need to respect. But when I talk to my students, I try to make sure they understand exactly where I'm coming from. I'm not woke. I'm not, I'm just an old white guy. I've got some education and I'm sharing it as best I can. And I have had students write back to me and said, when I started your class, I asked myself, what am I going to learn from some old white guy? And I was very surprised and pleased at the result of my education. So thanks for that experience. I think the more open we are about who we are and where we're coming from is going to, pay dividends in the long term. So that was what I wanted to say.
Thank you. Tony, I'm going to hand it over to you, and then I'm going to go ahead and give us a quick summary here.
Thank you. That's a tough act to follow there. But I just want to say, first of all, Glenda, thank you for putting these on. It's much appreciated. It's a good opportunity. If you notice, I do listen a lot, and it's a good opportunity to share ideas and thoughts. But more importantly, to share experiences. And, we heard about talking to the spouse about racism and everything else, and the experience that we all bring as professionals, and we're able to share that information and build on it. I think that's important. Thank you to Lynn for a nice presentation, and Marina, you added some good comments after that. So I really appreciate the fact that we have an opportunity to share as professionals, to share ideas and thoughts, and do it in a very safe form, because we all learn from each other's mistakes too. Because I'm just learning on this, and by your experience, I'm able to not make a mistake, because I'm able to take that experience and build on it. So thank you very, very much.
Thanks, Tony. That was like a perfect segue. It's almost like I planned it, because I was going to also thank Lynn and Marina for volunteering to put out their information. And then I was going to kind of, I wanted to summarize some things and real quickly speak to next week. So what Scott was talking about was a relational connection and cultural humility in our interactions with students, which to me is a humanizing way of interacting. And I've recently had some conflicts on campus that I didn't anticipate with administration. I think because what we're trying to do is really countercultural. We're really trying to work on humanizing and conflict resolution, not conflict avoidance. And so what I'm realizing is how much as a community, when we engage in humanizing, cultural humility, relational connections, seeing students as humans, this can be very countercultural to what may be going on our larger campuses. But that is why we do what we do, right? Is to be able to be a true, in my mind, education is one of the few fields that still can be rooted in a humanistic perspective. And so I think that's the work that we're doing. Now, if you are leaving these conversations with more questions than answers, and you're just wondering like how to integrate it in your practice, then that's what my intention is. So maybe I should say that from the beginning. I believe all of you all are incredibly collaborative and wonderful professionals. And if you leave here with more questions than answers, then that means you're just reflecting on your practice, reflecting on your practice, which is the very like kind of theory or model that I come from in this space. I want to also say that I want to make sure that we are putting things like racism, sexism, homophobia, and all of these important issues that affect the day in and day out experiences of our students, that they continue to be on the table and discussed in whatever topics that we're doing. So on that note, really quickly, and then I'll let you go, next week we've invited faculty, staff, and administration, although there won't be many administrators there because apparently I scheduled this during their like weekly meeting. I sent an apology email. next week, what I was hoping to do is I was going to take some of the pictures that we have and kind of really quickly talk about our model and what we're doing so that the faculty and staff that come can kind of get an idea of what we're doing. So I'm going to do like a 15, 10, like hopefully just from 9 to 9:15, we'll have like just a here's what we're doing. And then I'm going to open it up to y'all to answer questions. One of the things that I think will be most helpful, and you'll get another email from me before next Wednesday. One of the things that I think will be most helpful is if you can come with specific examples, like what Alex shared today. Because I think these specific examples of either how collaboration is helpful for you, what you found to be effective, or what things you're still trying to figure out, those examples will stay with people as they're trying to kind of get a mind around what we're doing during the pandemic in order to continue to offer college courses to students who are incarcerated. So that'll be next week. Overall, I love that we can be a community of learners. I'm so thankful that you all take time to be here. And I'm not making any promises, but our union is working hard to get CARES dollars to get you all compensated for this extra work. No promises, which is why you see optional all the time on my stuff. But I am working on it. I am working on it. If anyone does not receive, if anyone does not get paid today for some weird, crazy reason, please let me know, because we also have our eyes on that.
Okay.
So
I did get paid, Kalinda.
you did?
I did, yeah.
Oh, good. Thank God.
I still haven't seen a contract though.
So there is a contract that's available online. I don't know whether we're mailing contracts to everyone or not. But I can give you the link to the online contract. The new one that just
My contract or just a general contract?
you haven't received a TCS.
Right. That's what I call it, a contract.
Yeah. This semester contract. Yeah.
Correct.
How many people didn't get a TCS yet? Just one?
I'm always.
I didn't get mine either.
You didn't get ones? Did you all get paid?
Yes, I did.
I got paid.
Okay, that's what I'm mostly concerned about, but I'm sure you're concerned about the actual contract itself. Send me and Mari an email if you didn't get your TCS, please.
Okay.
Teresa, are you talking? Because I can't hear you. All right, you all stay if you want to chat some more. If not, I will see you at Work Exchange this week or next week on Wednesday.
Okay, thank you.
See you all.
Bye.
Bye, everyone.
Bye.
Linda,
Bye,
I
everyone.
have a couple